Welcome to this lecture on the pituitary gland. Today, we are going to explore one of the most fascinating and critical structures in the entire human body. We will uncover how this tiny organ bridges the gap between your brain and your endocrine system, acting as the ultimate command center for your hormones. By the end of this session, you will understand not just its anatomy, but the mathematical principles governing how it communicates with the rest of your body. Let us dive in. To begin, imagine a massive, highly complex factory with thousands of workers operating heavy machinery around the clock. To keep everything running smoothly and safely, there is a tiny, highly secure control room located right at the center of the building. The pituitary gland is exactly like this vital control room for your entire body. Even though it is only about the size of a small green pea, it acts as the chief executive officer of your endocrine system. Without this tiny but mighty structure, your thyroid, adrenal glands, and reproductive organs would have absolutely no idea what to do or when to do it. Now that we understand its role as the master control room, let us look at exactly where it is located. Anatomically, the pituitary gland is known scientifically as the hypophysis. It is a small, oval-shaped organ that sits safely tucked away in a protective bony depression called the sella turcica, which is part of the sphenoid bone at the base of your skull. It does not just float there independently, though. It is physically and functionally tethered to the hypothalamus above it by a delicate, stalk-like structure known as the infundibulum. This physical connection is absolutely vital for its function. Building on that anatomical connection, we must understand that the pituitary is not just one uniform gland. It is fundamentally divided into two distinct structural lobes that have completely different embryological origins. The anterior lobe, or adenohypophysis, is made of true glandular epithelial tissue that actually derived from the roof of the embryonic mouth during development. In stark contrast, the posterior lobe, or neurohypophysis, is not true glandular tissue at all. It is actually a direct downward extension of the neural tissue from the brain itself. This dual nature is the defining characteristic of the gland. Because these two lobes come from different origins, they operate in completely different ways. The anterior lobe relies on a specialized blood vessel network called the hypothalamo-hypophyseal portal system to receive chemical instructions from the brain. It waits for hormones to wash over it. The posterior lobe, however, acts like a direct wiring system. It relies on direct nerve fiber connections from the hypothalamus to release hormones like oxytocin and vasopressin straight from the nerve endings into the bloodstream. Understanding this structural divide is the absolute foundation for mastering how our bodies regulate everything from growth to stress responses. Let us solidify this with a visual representation. Here, you are looking at a cross-section of the hypothalamus and the pituitary gland. Notice the stalk, or infundibulum, connecting them. On the left, you see the anterior lobe, the adenohypophysis. Look closely at the red and blue network. That is the hypothalamo-hypophyseal portal system, the blood vessels carrying chemical signals. Now look at the right side, the posterior lobe, or neurohypophysis. Instead of blood vessels, you see yellow nerve tracts extending directly down from the hypothalamus. This diagram perfectly captures the dual nature we just discussed, a blood-driven anterior and a nerve-driven posterior. Now that we have seen the anatomy, why does this specific structure matter in the real world? It matters because this anatomy directly dictates how diseases manifest in patients. The pituitary is trapped in a tiny, enclosed bony space. If a patient develops a tumor here, the mass has nowhere to go. It can push upward and compress the optic nerve, causing blindness. Or it can press on the infundibulum and disrupt that delicate portal blood flow we just saw. This can lead to a complete shutdown of hormone production. Without this deep structural knowledge, doctors could not safely treat these life-threatening conditions. Since the anterior pituitary relies entirely on that delicate blood flow to receive instructions, we can actually model this using a fluid dynamics principle. The formula on screen shows how we calculate the concentration of a releasing hormone arriving at the gland. CAP represents the concentration of hormone inside the anterior pituitary, measured in nanograms per milliliter. R-hypo stands for the rate at which the hypothalamus secretes the hormone, in nanograms per minute. Finally, Q-portal is the volumetric blood flow rate through the portal system, in milliliters per minute. Physically, if the brain secretes more hormone, the concentration goes up. But if the blood flow speeds up, it dilutes the hormone, and the concentration goes down. Let us see this formula in action with a concrete example. Suppose we are studying a healthy patient to understand their baseline metabolic function. We are given that the patient's hypothalamus secretes corticotropin-releasing hormone at a steady rate of 45 nanograms per minute. The structural blood flow through the portal veins is measured at 15 milliliters per minute. We need to find the exact concentration of the hormone arriving at the cells. We chose our concentration formula because it perfectly relates secretion and flow. We substitute 45 for the numerator and 15 for the denominator. Dividing these gives us a final answer of 3 nanograms per milliliter. This means every milliliter of blood delivers exactly 3 nanograms of hormone to trigger the target cells. Now that we have used this formula, let us understand where it comes from conceptually. This is a short proof based on fluid dynamics. We start with the fundamental definition of concentration, which is simply mass divided by volume. However, in a living body, blood is constantly moving, so we must look at rates over time. The total mass of hormone delivered every minute is exactly the secretion rate, R-hype. The total volume of fluid arriving every minute is the blood flow rate, Q-portal. By dividing the mass per minute by the volume per minute, the time units cancel out. This leaves us with mass per unit volume, proving exactly why our formula accurately models how chemicals are diluted in moving physiological fluids. With that proof in mind, let us tackle a more complex clinical scenario. Imagine a patient with a small, benign tumor pressing on the pituitary stalk. This physical mass restricts the normal portal blood flow significantly, dropping it to just 5 milliliters per minute. Sensing a deficit, the hypothalamus tries to compensate by increasing its secretion of gonadotropin-releasing hormone to 60 nanograms per minute. We are asked to find the new concentration reaching the gland. We use the same formula, plugging in the new compensatory secretion rate of 60 for the numerator and the restricted blood flow of 5 for the denominator. Dividing 60 by 5 gives us a final concentration of 12 nanograms per milliliter. Let us interpret the physical meaning of that final answer we just calculated. The resulting concentration is 12 nanograms per milliliter. Physically, this shows that even though the blood flow was heavily restricted by the tumor, the actual concentration of the hormone bathing the cells has quadrupled compared to normal baseline levels. This abnormally high concentration can cause the anterior pituitary receptors to become completely overwhelmed and desensitized. This beautifully explains a real-world clinical phenomenon, why structural stalk compression often leads to complex, paradoxical hormonal imbalances in patients, rather than just a simple drop in hormone levels. We have covered a lot of ground today, so let us reinforce the most important ideas. First, the pituitary gland is a magnificent dual structure organ that serves as the ultimate bridge between your nervous system and your endocrine system. Second, remember the fundamental divide. The anterior lobe acts as a traditional gland, relying on a specialized portal blood system, while the posterior lobe is a direct physical extension of the brain's neural wiring. Finally, as we saw with our fluid dynamics calculations, the physical structural integrity of the gland and its stalk is absolutely vital for maintaining the correct hormone concentrations. You now have a solid foundation for mastering how our bodies regulate themselves.